Hello dear students, welcome to our new video. In this video we will be seeing some of the important MCQs based on absorption. So let's begin. The first question is, what is the primary site for drug absorption in transdermal drug delivery? And the options are, first one epidermis, then dermis, third one hypodermis, or fourth one subcutaneous tissue. Your time starts now. The correct answer for this question is epidermis. So transdermal drug delivery involves drug absorption through skin, primarily through the epidermis. Moving to next question. The second question is, what is the primary mechanism of drug absorption from most orally administered drugs? And the options are active transport, passive diffusion, facilitated diffusion, or endocytosis. So you have the timing for thinking for the right answer. The correct answer for this question is passive diffusion. So passive diffusion is the most common mechanism of drug absorption through the GIT. It involves the movement of drug from area of higher concentration to the area of lower concentration. Moving to next question. The question is, which of the following factor does not influence paracellular absorption of drug? And the options for this question are tight junction between epithelial cells, then molecular size of the drug, lipophilicity of the drug, and next is surface area of the absorptive membrane. Your time begins now. Time up students. The correct answer for this question is lipophilicity of the drug. Paracellular absorption is influenced by factors such as tight junctions, molecular size, and surface area, but not necessarily by the lipophilicity of the drug. Moving to next question. The question is, carrier mediated transport is the form of active transport that involves. Options are utilization of energy to move drug against a concentration gradient. Option number 2, passive movement of lipophilic drugs, then movement of drug through aqueous channel, and next is movement of drug through tight junction. Your time hurry up ends up now, and the correct answer for this question is utilization of energy to move drug against a concentration gradient, right? So carrier mediated transport, it requires energy and is involved in active transport of drug against a concentration gradient. Moving forward to the next question. The question is, which of the following factor is likely to enhance the absorption of a weakly acidic drug in stomach? And the options are presence of food, then fasted state, next is decreased gastric emptying time, and next is alkaline pH. The time have already started. Stop. The correct answer for this question is alkaline pH. So weakly acidic drugs are absorbed or better absorbed in an acidic environment in stomach. Okay. Then moving to next one. The viability of a drug absorbed through GIT may be decreased in presence of. The options are A, antacid, option number B, grapefruit juice, option number C, P glycoprotein inhibitors, or option number D, high fat meals. Your time have started. The correct answer for this question is option number C, that is P glycoprotein inhibitors. P glycoprotein inhibitors can decrease the viability of drug by inhibiting their efflux through enterocytes. Moving to next one. The question is, what effect does first pass metabolism in the liver have on the viability of orally administered drug? And the options are, first one, that is increased viability, next is enhanced drug absorption, decreased viability, or no effect on bioavailability. The options, your time have started. Please stop. The correct answer for this question is decreased viability. First pass metabolism can significantly reduce viability of orally administered drugs. Moving to the next question. The question is, what is the primary advantage of intramuscular drug administration? And the options are slow and controlled drug release. Next one is bypasses the first pass metabolism. Next one is avoidance of pain and discomfort, and last is direct delivery to the central nervous system. Your time starts. The correct answer for this question will be, you can guess meanwhile. So, the correct answer for this question is bypasses the first pass metabolism. Intramuscular drug delivery allows drug to bypass liver's first pass metabolism. Moving to next one. Absorption of drug through respiratory mucosa is facilitated by, and the options are mucus production, then high vascularization, next one is ciliary movement, and presence of tight junction. You can guess for the answer meanwhile. You have 10 seconds duration to think of. So, the correct answer for this question is high vascularization. So, high vascularization of respiratory mucosa facilitates rapid drug absorption into the bloodstream. Moving to the next question. The question is, absorption of a drug through rectal route is influenced by. The options are presence of enzyme in the rectum, first pass metabolism, P glycoprotein activity, or pH of rectal fluid. You can think of the correct answer. The correct answer for this question, yes, first pass metabolism, pH of rectal fluid. Okay, time up. The correct answer for this question is presence of enzyme in the rectum. So, enzyme in the rectum can influence the absorption of drug administered rectally. Getting? Moving to next question. The question is, buccal drug administration is advantageous for drugs with. The options are low lipid solubility, rapid metabolism, low permeability, or high first pass metabolism. The correct answer for this question will be after 10 seconds. You have 10 seconds to think for the answer. Stop. The correct answer for this question is high first pass metabolism. So, buccal administration bypasses the first pass metabolism, making it advantageous for drugs with high first pass metabolism. Getting? Moving to next question. The question is, intranasal drug delivery is commonly used for. The options are systemic absorption, next is local effect in nasal cavity, third one is prolonged drug delivery or drug release, and avoidance of irritation. You can think for the right answer in the 10 seconds. Yes, what do you think? What is the most relevant to the question? So, the correct answer for this is systemic effect, right? So, although intranasal delivery is used for both local and systemic effect, however, most commonly it is employed for systemic effect. Okay, so systemic effect is correct answer for the question. Moving to next one. The question is, which of the following is potential limitation of transdermal drug delivery? And the options are bypassing first pass metabolism, next skin irritation, rapid drug metabolism, or low patient compliance. You can think for the answer. Yes, transdermal drug delivery system limitation. The correct answer for this question is skin irritation. So, transdermal delivery may be limited by skin irritation, especially with certain formulations. Moving to the next question. Which specialized transport mechanism is responsible for absorption of certain nutrients, drugs, and ions against their concentration gradient in small intestine? I repeat the question. Which specialized transport mechanism is responsible for absorption of certain nutrients, drugs, and ions against their concentration gradient in small intestine? The options are first one, that is facilitated diffusion, next simple diffusion, active transport, or paracellular transport. You can think for the correct answer. Stop. The correct answer for this question is active transport. So, active transport is involving the movement of drug against their concentration gradient, right? And it requires energy. Moving to the next question. The question is, in which non-peroral extravascular route of drug administration does the drug primarily bypasses the hepatic portal circulation? And the options for these questions are intramuscular, rectal, transdermal, or sublingual. You can think for the right answer within the given time. Stop. The correct answer for this question is sublingual. Okay, so sublingual administration allows for direct absorption into the systemic circulation, bypassing the hepatic portal circulation. So that's all in today's video. Thank you for watching till end.